Lisa Sedlak, Marriage and Family Therapist with Journey Points Therapy Services. I want to take a couple of minutes to talk to you parents whose kids are home and talk to you about how to manage their mental health. A lot of kids have struggles in general with anxiety or depression, and sometimes the changes that we have been going through can exacerbate those things. And I just want you guys to be aware of what types of symptoms to look for and where to go for resources. Two of the very simple resources that I use on a very frequent basis for students in assessing their anxiety and depression are the PHQ-9, which is an easy assessment that you can get online, and it asks questions about levels of depression for your child. It asks things such as, does your child have little interest or pleasure in doing things? Does your child feel down, depressed, or hopeless? Do they have trouble falling asleep? Do they have a poor appetite, or are they overeating? Do they feel bad about themselves? Do they have trouble concentrating on things? Are they moving or speaking at a slower pace? And do they have thoughts that they might be better off dead, or thoughts of hurting themselves? So those are some things that you can use to kind of assess if they might be feeling depressed or if they have depression that is worsening. The other resource that I really enjoy using and assessing anxiety is the GAD-7, and that again it assesses anxiety. It asks questions about whether or not students are feeling nervous, anxious, or on edge, whether they are able to stop or control worry, whether they worry too much about different things, if they have a hard time relaxing, if they feel afraid, if that something awful may happen. And so these are some things that are on the GAD-7. Again, the resources that I highly recommend using to assess whether or not there are some depression or anxiety issues going on for your child are the PHQ-9 and the GAD-7. Great resources. And just pay attention to your child, whether they're isolating more than normal, whether they seem to be sleeping more than normal, if they are eating a lot more or a lot less than normal. Those are some indicators that things might not be going as they should, and that you should have some conversations with them about their needs. And if you do realize that your child has depression or anxiety, or if either of those has increased for your child, please reach out to get support from your local therapists. There are lots of providers in the area that are working. Some might be seeing clients in person, and others will be doing telehealth, and either are great ways to offer support to your students. Thanks much. Take care, and as I always say, make it a great day.